Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there's one new case of COVID-19. Total number of cases is 298. There are 282 individuals that are listed as recovered, and there are 9 active cases. Yesterday, an additional 824 lab tests were performed, taking our total to 45,923. Today's case and the previous 3 cases are all linked to a cluster associated with the temporary foreign workers in the Southern Health region. Once again, there is no significant risk to the public's health. All measures were taken appropriately. Cases and contacts are being isolated at this time. Manitoba's plan for Phase 2 of service restoration is well underway. And again, we reemphasize this is not a return to normal, that it's a broad reopening, a prudent reopening given our numbers, but there are a number of restrictions still in place to ensure the limited transmission of this virus. So again, a number of occupancy restrictions, ensuring physical distancing can take place in public. And so going forward, we've said time and again that it's vital that people who are ill are staying home. Do not show up for work if you have symptoms, even mild symptoms. Do not go out shopping or attend a sporting event. We need to ensure we're staying home, keeping track of our symptoms. Certainly present for testing if you have any symptoms of COVID-19, fever, chills, cough, sore throat, runny nose, aches, headache. Even if they're mild, even if you're not sure, present for testing. We have still a lot of capacity for testing, and it's ideal if we can get to cases early so we can isolate as well as do some contact investigations. It can be very important for our success moving forward. And so Manitobans are well versed with all the things that we need to do, washing our hands frequently, staying home when we're ill, maintaining that physical distancing at all times. This is especially important to those who are at increased risk of infection, those over age 65, those with underlying medical conditions, or those with immune compromise need to take extra cautions to ensure they're not being exposed to this virus. So once again, thanks to all Manitobans for putting us in this position to continue our planned phase reopening. And continue to visit our website at manitoba.ca/COVID-19 for up-to-date information. So thank you. I'll pass that to Lanette.
Thank you very much. Good afternoon, everyone. I'm Lanette Siragusa, Chief Nursing Officer with Shared Health. We have often said that during this COVID-19 pandemic response that we will have to evolve and change over the course of this pandemic. And thanks to the tremendous efforts of Manitobans, our numbers of active cases are low. And in response, we are very pleased to be able to expand our visitor access for inpatients in Manitoba's hospitals and health centers. We know that the last few months have been incredibly difficult for patients and their families. Both Dr. Roussin and myself have received many letters from you, heard personally the stories, and we want to thank you for sharing those honest feedback and personal stories with us. The new visitor guidelines will allow most inpatients to identify a single designated support person who may visit them once a day. Inpatients who have been in hospital longer term for more than 14 days will be allowed to identify a second support person to visit for the duration of their stay in hospital. Most visitors will be restricted to visiting one at a time, though exceptions will be made for children under 14 who need to be accompanied by an adult. Exceptions have also been made for specific patient populations. For labor and delivery, mothers may identify 2 support people who will be present at the same time, and one of those support people may be able to stay overnight. Following the birth, 2 designated visitors can be present at the same time. On pediatrics, 2 designated caregivers may visit every day, regardless of the child's length of stay, and 1 patient may stay overnight with the child. For end-of-life care, it is not always possible to accurately predict when this will happen, but the care team will consider the stage of illness, the trajectory of decline, and the projected timing of death. During the last 2 weeks of life, a maximum of 4 designated support people may be identified to visit. 2 support people may visit together anytime outside of visiting hours, so long as physical distancing can be maintained. Cancer Care Manitoba, patients may also be allowed a support person if they require assistance in accessing their appointments or treatments. Patients who are suspected or confirmed with COVID will be allowed visitors, but it will be restricted somewhat. Clinical care teams will grant exceptions and work to make sure that the appropriate PPE is worn and applied appropriately. Visitors will continue to be screened upon entry, and those who have traveled, who have had close contact with a suspected or confirmed COVID case, and are required to self-isolate, as well as anyone who has symptoms, will not be permitted to visit. We expect this expanded visitor access will begin at some locations as soon as Friday, but at the latest early next week. Care teams will be in contact with families to discuss who the designated support people will be, preferred times of day for visits, as well as any specific operational information. And this will be another evolution as we learn and adapt through this pandemic. We believe these new guidelines strike a balance between protecting staff and patients, minimizing the spread of COVID, as well as ensuring that those vital connections with loved ones helps to promote health and healing. As facilities work to operationalize these new guidelines, we will assess the implementation and consider any changes that need to happen ongoing. We are also encouraging facilities to consider their operational ability to support outdoor on-site visits, similar to what's already been implemented in the personal care homes, as well as piloted at Victoria Hospital. Families are encouraged to continue to use virtual means to connect with their loved ones. And while we are pleased to be able to permit in-person visits now, we will continue to monitor the presence of COVID in our communities. And if necessary, we may need to restrict access again to keep patients safe and our community safe from the spread of the virus. Moving on to testing sites. Community testing sites in Dauphin and Swan River have moved to new locations. Starting today, Dauphin's drive-through site is now located in the parking lot at Dauphin Community Health Services building. Hours are 10 a.m. to 2 p.m. Monday to Friday. Meanwhile, the testing site in Swan River is now located in the parking lot at the Swan Valley Primary Care Center. And this site will be open Monday to Friday, 10 a.m. to 1 p.m. These community testing sites were formerly located at MPI garages, so I would like to say a big thank you to MPI for allowing us to use this space over the past several weeks. Additionally, our drive-through testing site in Brandon remains open Monday to Saturday from 8:45 to 3:15 p.m., and it will now be closed on Sundays. And finally, we will be winding down our Bison Drive testing site in Winnipeg in the next week or so, and we will have an update for you in the coming days as to where people can travel to get their testing in the south end of the city. Addresses and hours of operation for all community testing sites in the province can be found online at manitoba.ca/COVID-19. And with that, we can open the line to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary question and one follow-up question. Up first this afternoon from the Brandon Sun, Kyle.
Hello there, this is Kyle from the Brandon Sun. I'm just looking, I suppose this question is for Ms. Siragusa. Can you just clarify what the visiting access was before this date and how it differs from the new policy you guys announced?
I'm not sure what the evening, I can't recall off the top of my head what the evening access was, but I do know the volumes were quite low in Swan River and Dauphin, or they were decreasing over time. So we wanted to ensure that there was access still available. But we can look into evening access and get back to you, Kyle.
Okay, thank you.
Actually, it's probably online. You can look at what the hours of operations are.
And with regards to the hospital visiting hours, visiting access, what did those look like before today, just in general across the province?
What have they looked like up until today?
Yeah.
So the hospitals have been restricting visitors to reduce the spread of COVID and keep staff and patients safe. So for the most part, for compassionate reasons on a case-by-case basis, people would be allowed to visit. But it really was quite minimal up until now.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Dr. Roussin, you're calling these cases in the Southern Health Region a cluster, not an outbreak. Can you explain why that is and share more details on the situation there? Has everyone else been tested now? I know you mentioned there were 18 people in relatively close quarters, and what's the situation as far as self-isolating? Are they all being kind of closely monitored at this point?
Right, yeah. And so, I mean, the distinction between a cluster and an outbreak isn't definite. Usually just a smaller numbers will term it a cluster in that area. So we had, there was 4 cases and 2 of the close contacts have tested negative, but they'll all be self-isolating. The other non-contacts, but also workers there, temporary foreign workers, have all been tested, and there are just 3 samples that are pending still, and then there were 6 local workers also tested, all came back negative. So that's why we don't feel there's any real risk to the public here. People are being self-isolated, and it appears that this will be a limited cluster.
Okay, thank you. And just as a follow-up question for Lanette, with regards to the obviously plenty of changes coming up for visitors to healthcare facilities, as personal care homes have been doing outdoor visits for not quite the last week, but they have been having those outdoor visits. Can we expect to see some changes to personal care homes as well as far as indoor visits, or will they stay outdoors?
Part of it is the ventilation and the traffic and also the risk to the population. We know those PCHs are high-risk areas just because of what we've seen throughout the country. So we do want to be extra cautious. We are looking, though, at the end-of-life care guidelines that we're setting up for acute care. We'd like to look at implementing those in PCH as a first step, and then we'll continue to evaluate as we go and make changes accordingly.
From the Winnipeg Sun, Scott.
Hello, Scott Doak here, Winnipeg Sun. Question for Dr. Roussin. I don't know, have you guys been able to quantify, like, how many people have returned to the province during this, during the outbreak? And do you know how many people have returned from travel have tested positive as opposed to those who haven't?
Well, we don't have it's a very tough number to track on how many people have returned from travel, so we don't really have that. We know that the number of our known cases related to travel is about 47% of our total cases are related to travel.
Yeah, I'm just trying to understand, like, it seems like, a lot of these cases, whether it's been the truck drivers lately or the temporary foreign workers, all had travel in, and I assume travel, at least for two of them, into the U.S. I'm just trying to understand the danger of traveling into the U.S. right now when it comes to people coming back and eventually maybe testing positive.
Yeah, I'm sorry, you're breaking up a little bit there, but I don't have, certainly the proportion of returned travelers. We certainly know that these last 6 cases for sure have been travel related, and that's why we have a number of limitations on travel right now, certainly internationally, and then that's why we have our 14-day period self-isolation for interprovincial travel, and then certainly that we need to allow for processes to keep our supply chains moving. And that's why with the, truck drivers, that is exempted, but they do have guidelines that they need to follow, and certainly these recent 2 certainly did follow those. And then we're also looking to do the asymptomatic testing now of returning truckers from outside the province. So, like we said, when our numbers are quite favorable, then our biggest risk is the importation of the virus. So we do have a number of processes in place to try to reduce that risk.
From CBC Manitoba, Aidan.
Hi, my question is for Dr. Roussin. Can you tell us specifically what practices did the workplace employing the temporary foreign workers have in place regarding to isolation protocol, spacing for living conditions, and cohorting, and what is the risk to these workers?
Yeah, and that's right. So you mentioned all of them there. Is that when temporary foreign workers enter our country, they're required to self-isolate for 14 days, and then while they're working, they're cohorted. So to limit that, and then so in this example here, we talk about the 18, but they were cohorted in 6s, and we don't have a positive case outside that original cohort. So it's likely that contributed to the reduction of the cluster numbers, and then certainly with living conditions, ensuring physical distancing. So all the steps were taken in this particular episode. Certainly our biggest risk is the importation of virus, but when we handle it in this way, it dramatically reduces the risk to the public.
Just to follow up on that, when the workers are isolating, are they in group living conditions? Are they being cohorted in the same working groups of 6? And if they were cohorted in a working group of 6, why is the larger group of 18 a matter of concern?
Yeah, so a few questions there. So when they're self-isolating, I don't know there's a number of different setups like this. When they're self-isolating, they should be able to maintain physical distancing from all others during that self-isolation period. And then when they're working, it's ideal to have them in the same cohort, just for this reason. And really, the other 18 were very low risk. They're not considered contacts, but because there's relatively low numbers. In a relatively small place, we opted to do asymptomatic testing on them. So similar to what we did in our cluster in Prairie Mountain Health, we tested all the employees in there, even the ones that weren't cohorted. Certainly didn't find a case outside of that, but we felt it was just prudent to do that testing.
From the Canadian Press, Steve
Lambert from the Canadian Press. Dr. Roussin, can you tell us whether this, if my math is right, this is a cluster of 4 related to these temporary foreign workers in the Southern Health region? Can you tell us whether this was an agricultural operation or a healthcare operation? What field was it in?
Yeah, so it's we're limiting it to the information to the southern region. It's this cluster of temporary foreign workers, and there's no exposure to the public. So we want to ensure we're advising Manitobans that these are imported cases, that we're not seeing, say, the community-based transmission with this. But then again, we also want to respect the privacy of individuals. So no risk to the public is the biggest message we want to give.
And following up on Aidan's question, it sounds like the 4 were working while self-isolating. Is that correct?
Well, they were not. They shouldn't have been working while they're self-isolating. So the self-isolation period should be before any work, or certainly before being in contact with other individuals. So I don't know the exact details on all of these things, but certainly there's no exposure to the public, and it doesn't appear to be really any exposure to anyone outside of that cohort.
From CTV Winnipeg, Michelle.
Hi, Michelle from CTV Winnipeg. I'm just wondering, with the patient visitor access, because most patients will be eligible, can you maybe tell us who isn't eligible to have a visitor?
I would say that's mostly on the unit, which we don't have right now, but we have designated units that are for COVID patients, confirmed COVID patients. So we call those our red zone areas. So we will want to keep traffic minimized if and when we get patients, COVID patients, and make sure that when people do come on a case-by-case basis that they have the appropriate PPE and they wear it the way they're supposed to wear it, and they don it and doff it in a safe way. So that will be the biggest limitation. We also will have some units where suspected COVID patients would go, and that's really people who may have respiratory illness or fever or cough, and we want to test them to be sure. Those are very short stay because it's really pending a lab test that comes back in 24 to 48 hours. So those are the situations where visitor restrictions would be more carefully applied. But for the most part, most inpatient visitors should be able, inpatients should be able to have one visitor at least short term, and then more if they're longer.
Then what about privacy? Like, are people going to be able to come into the hospital, be able to go bedside, or will someone from the hospital have to accompany them? Like, what sort of privacy are they able to have with their loved one?
Well, I think, it's really the physical setup of the hospital. So there are hospital rooms that have single patients, double patients, some even more than that. So it's an issue perhaps all the time, not just when COVID is around. So there are ways with if there's a place to move patients, if they want to meet with their loved one in a different setting, in a lounge, that's possible. There's also privacy screens that can be used. For sure, we have to work with the space we have, and we want to respect people's privacy, and we also have to respect physical distancing. So the staff are very much looking forward to having patients, their visitors, come back to the hospital, and they will do their best to make it work.
From the Winnipeg Free Press, Larry.
Larry Critchard, Winnipeg Free Press. Dr. Roussin, I'd just like to return to the temporary foreign workers, just double-checking some of the facts. 4 of the 18 temporary foreign workers have tested positive, and when you were talking about 6 others to receive the test, were they 6 of the 18 or 6 others connected with this establishment?
Right, yeah, so there was 18 temporary foreign workers. There was a cohort of 6, which all 4 of these cases occurred in, and so only the 2 remaining of that 6 are considered close contacts. But we tested, everyone who worked in that in and around that location. So the rest of the 18 temporary foreign workers, and then there was 6 local workers as well that we tested, all negative.
A secondary question. The rally that's going to occur on Friday at the Legislative Building, the crowd is expected to be fairly sizable. Just wondering what your concern is about, any potential health threat from a large rally, and what's your advice for participants?
Yeah, so I'd want all the participants to be mindful and try to remain safe, do that in a safe manner. So we still have the groups of 50 outdoors right now, so I would encourage to stick with that. Try to have physical distancing whenever possible, and decide to stay home if you're feeling ill. Don't show up to a large gathering like that if you're feeling ill, even with mild symptoms. So I just want everyone to stay safe.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Dr. Roussin, given that you said the past 6 cases are travel-related, can you talk about how that kind of impacts maybe the ability to change the rule on the 14-day isolation for both interprovincial or international travelers?
Yeah, well, I think that as our numbers remain favorable like this, then we have to be very mindful of the importation of the virus, and so those are the measures that we have in place right now. So certainly the Quarantine Act with the travel restrictions and the mandatory self-isolation, mandatory quarantine for those returning from international travel is in place, and given the numbers, especially in the U.S., it's has a lot of reason to remain in place going forward for the foreseeable future. And then interprovincially, same thing. We see that there's still some provinces that didn't benefit from our timing or our geography and are still seeing numbers of this, more than us. So we still need to protect against the importation. So we're continuing to look at that. We're looking at ways of being able to narrow some of our approach for those 14-day self-isolation requirements. But for the foreseeable future, we're going to have some sort of way to protect Manitobans against the importation of the virus.
Thank you. And this is a follow-up going back to the rally that is planned for Friday. If we look at some of the other rallies we've seen in other areas of the country or in the U.S., there's definitely been more than 50 people gathering, and physical distancing might be kind of hard to do. With that in mind, what's your response to that, or the message that you would have for people attending?
Yeah, so that's our general message. Try to stay safe. We know that this virus, we've seen favorable numbers, but it's still here, and crowded, large groups could put us at risk for transmission of this virus. So washing your hands, trying to maintain that physical distancing, trying to limit the group sizes is best. Certainly stay home if you're ill. If you're feeling that you're not going to be able to maintain that physical distancing, then you can consider a non-medical mask as well. So really important to try to stay safe during this time.
Thank you. We have a few moments left. If our reporters on the line have any additional questions, please ask them now.
Dr. Roussin, I am from 680 CJOB. You mentioned narrowing the scope of these self-isolation restrictions for domestic travelers, possibly. Would that mean the province wouldn't require people from certain provinces where there is favorable epidemiology to self-isolate for those 14 days? If so, when might we expect that, and what would the kind of requirements be on the province's part in terms of saying, okay, it looks pretty good here, we're not going to require you to self-isolate if you come from there?
Yeah, so I don't have any, like details on it, but those are the type of things that we are looking at, whether we don't need to have, say, a blanket interprovincial requirement, that we may look at certain jurisdictions that have favorable epidemiology that's comparable to ours, that we may not require that 14-day self-isolation. And then the same thing, we would be monitoring for triggers in various areas to whether we need to change that. So that is one of the things we're looking at now, and probably in the upcoming weeks we'll be able to consider that.
Hi, Aiden from CBC News. My question is for Dr. Roussin. What are the requirements for employers who employ temporary foreign workers in terms of that isolation period, for conditions for the workers, and do the workers have access to the special isolation suites that have been made available by the province?
Yeah, so the requirement is the 14-day mandatory self-isolation, and so that must be done in a manner that they can be physically distanced from others. And then cases that are cases or contacts from anywhere in Manitoba, they are eligible for their alternative isolation accommodations. So yes.
I would also just add, we have been working in close partnership with the Public Health Agency of Canada, who flags when someone is coming into Manitoba. So we do make sure that they have a place to isolate, and work together on making sure that happens.
This is Kyle Darvison from the Brandon Sun. I just got some unconfirmed reports that the town center mall, which is where our local testing site is located here in Brandon, is potentially, and this isn't confirmed, being evacuated due to structural issues right now. Would anybody be able to confirm that for me? And if so, is there a contingency plan to relocate the testing site in Brandon to an alternate location?
Well, that's hot off the presses. We didn't know that, but we will look into it and we will see what our contingency plan is. Thanks for letting us know.
Yeah, again, that's not confirmed. I just heard that from one of my colleagues. So
okay.
Hi, Aiden from CDC again. I'm just wondering about classifying cases as travel-related. So the original case that we learned about on Sunday, you said is travel-related. And so are these three cases that we've learned of since, are they also considered travel-related, given that they likely got this from the index case, or how does the classification work there?
Yeah, so it's good. It's a good question. I think that the important thing is that we wouldn't classify them as our community-based transmission. So they'd either be travel or related to contact with of a known case, and so that's the big distinguishing factor. So our EPI folks, they'll have specific ways of how they classify these things, but what's really important from our public health measures is that these aren't considered community-based transmission.
Larry Cush at the Winnipeg Free Press. Dr. Roussin, does Manitoba have much of a presence at the borders with Ontario and Saskatchewan anymore in terms of, checking or speaking to people traveling into the province, or has that been done away with?
Yeah, that's been rolled back over time. The actual checkpoints there have been rolled back. So there's still a lot of signage there. There's still a small amount of presence, but over time that's rolled back. We found a lot of just repeat messaging to many of the same folks. Certainly the truck drivers returning weren't being stopped by that because they have the exemption. So over time there was less need for having the checkpoints. Still have a lot of the signage and the education out there.
Is there a fear with summer coming, with holiday season, that maybe it might be wise to do that again?
Well, we're going to look at it and see, depending on, where people are coming from, especially with road traffic. Most of our exemptions apply to neighboring communities anyways. The epidemiology in northwestern Ontario is much like ours. And so there's, I think over time, there's limited need to have those checkpoints there.
Hi, Aidan from CDC. I'm just wondering about inspections for places, for workplaces in terms of making sure that employers are keeping all the protocols in place and making sure public health advice is being followed. So what is the province doing to ensure that places that employ, for example, temporary foreign workers are following the rules and keeping people safe?
Mm-hmm. Yeah, so I mean, certainly there's stringent guidelines that are in place and processes that have to be followed with these temporary foreign workers. I'm not sure if I can speak precisely to to the follow up on that. Certainly workplace safety and health is involved in many workplace issues here. I don't know for sure if that is one of the areas that they are involved in, but we can follow up. But I know that there's very stringent policies in place for hiring and for following up on temporary foreign workers.
And this concludes today's media briefing. Thank you.
Thank you.